Hi, welcome to this health channel where we focus on simple, practical, and science-based information to help you understand your body and protect your health in a smarter way. I'm Dr. Ethan Wilson, your daily guide to simple and smart health tips. Today, we are going to talk about one of the most important topics in modern health awareness. It is something that many people misunderstand. A heart attack is often thought of as a sudden, unexpected event that happens without warning. Movies and TV shows often show it that way. Someone is completely fine one moment and suddenly collapses the next. But in real life, the human body usually gives warning signs. The problem is that most people either ignore these signs or do not recognize them. The truth is, a heart attack rarely happens completely without any signals. In many cases, the body starts showing subtle changes days, weeks, or even months before a major cardiac event. These signs can be mild, confusing, or mistaken for something less serious like fatigue, stress, or indigestion. Today, we are going to discuss 5 hidden symptoms that may appear before a heart attack. Understanding these signs can help you act early and potentially save a life, your own or someone else's. Before we go into the symptoms, it is important to understand what a heart attack actually is. A heart attack happens when blood flow to a part of the heart muscle is blocked, usually due to a buildup of fat, cholesterol, or other substances in the arteries. When the heart does not receive enough oxygen-rich blood, the affected muscle starts to get damaged. The longer the blockage continues, the more serious the damage becomes. Now let's move into the first warning sign that many people ignore. One of the earliest hidden symptoms is unusual fatigue. This is not normal tiredness after a long day or physical activity. This is a deep, unexplained exhaustion that appears even when you have not done much physical work. People often describe it as feeling drained, weak, or unusually tired while doing simple daily tasks like walking short distances, climbing stairs, or even getting dressed. This happens because the heart is not pumping blood efficiently, and the body is not receiving enough oxygen. As a result, the muscles and organs start working harder than normal, causing fatigue. This type of fatigue is especially important to notice in women and older adults, as it can sometimes be the only early sign before a heart attack. Many people ignore it, thinking it is due to stress, aging, or lack of sleep. But when fatigue becomes unusual and persistent, it should never be ignored. The second hidden symptom is discomfort in the chest, but not always in the form people expect. Most people believe a heart problem always causes severe chest pain. However, in many cases it may start as mild pressure, tightness, heaviness, or a squeezing sensation in the chest. It may come and go rather than staying constant. Some people describe it as feeling like something is sitting on their chest. This discomfort may not always be severe enough to cause alarm, which is why it is often ignored. It might happen during physical activity or even during rest. Some people assume it is acidity, gas, or muscle strain. However, when chest discomfort is unusual, repeated, or associated with other symptoms like sweating or shortness of breath, it becomes a serious warning sign. The third hidden symptom is shortness of breath. This can occur even when you are not physically active. You might feel like you cannot take a deep breath or feel slightly breathless while doing simple tasks. This happens because the heart is struggling to pump blood efficiently, causing fluid buildup in the lungs or reduced oxygen circulation in the body. Some people notice this symptom when lying down, climbing stairs, or walking slowly. They may think it is due to aging, lack of fitness, or anxiety. But when shortness of breath appears suddenly or becomes more frequent over time, it should not be ignored. It is often one of the key warning signs that the heart is under stress. The fourth hidden symptom is discomfort in other parts of the body, especially the arms, neck, jaw, back, or stomach. Heart-related pain is not always limited to the chest. In many cases, the pain can spread or radiate to these areas. For example, some people feel pain or pressure in the left arm or both arms. Others may feel discomfort in the jaw or upper back. This type of pain is often misleading because it does not feel like a heart problem. People may assume it is a muscle issue, dental problem, or digestive issue. However, when this discomfort appears along with other symptoms such as chest pressure or shortness of breath, it becomes more concerning. The fifth hidden symptom is sudden sweating, especially cold or excessive sweating without any physical effort. This type of sweating is different from normal sweating after exercise or heat exposure. It can occur suddenly and may be accompanied by weakness, dizziness, or nausea. This happens because the body is under stress and the nervous system is reacting to reduced blood flow to the heart. People often describe it as breaking into a cold sweat for no clear reason. It may happen during rest or light activity. This symptom is particularly important because it often appears during the early stages of a heart attack or even during a silent heart event. Now, it is important to understand that having one of these symptoms does not always mean a heart attack is about to happen. These signs can also be related to other health conditions such as anxiety, digestive issues, or muscle strain. However, the key factor is pattern and combination. When multiple symptoms appear together, or when a symptom is unusual for your normal health condition, it should always be taken seriously. Another important point is risk factors. Some people are at higher risk of heart disease due to conditions like high blood pressure, diabetes, high cholesterol, obesity, smoking, lack of physical activity, or family history of heart disease. For these individuals, even mild symptoms should not be ignored. Prevention plays a very important role in heart health. While recognizing symptoms is crucial, it is even better to reduce risk before problems start. A healthy lifestyle that includes regular exercise, balanced diet, stress management, and regular medical checkups can significantly reduce the risk of heart disease. Diet is especially important. Foods high in saturated fats, trans fats, and excessive sugar can contribute to blocked arteries over time. On the other hand, fruits, vegetables, whole grains, nuts, and healthy fats like those found in fish and olive oil can support heart health. Physical activity is another key factor. Even simple activities like walking for 30 minutes a day can improve circulation, strengthen the heart muscle, and reduce risk factors. You do not need extreme workouts. Consistency matters more than intensity. Stress is also a silent contributor to heart problems. Chronic stress can increase blood pressure and lead to unhealthy habits like overeating or lack of sleep. Learning to manage stress through relaxation techniques, deep breathing, or hobbies can make a significant difference. Sleep is often underestimated, but plays a major role in heart health. Poor sleep quality or lack of sleep can increase the risk of high blood pressure and other cardiovascular issues. A consistent sleep routine helps the body repair and regulate important functions. It is also important to talk about the difference between sudden heart attacks and silent heart attacks. Some heart attacks are dramatic and intense, but others are mild and may go unnoticed. These silent heart attacks can still cause damage to the heart and increase the risk of future serious events. Because of this, awareness becomes extremely important. The more you understand your body, the better you can respond to warning signs. Early action can make a life-saving difference. If someone experiences multiple symptoms like chest discomfort, shortness of breath, sweating, or unusual fatigue, it is always better to seek medical help immediately rather than waiting. Many people delay seeking help because they hope the symptoms will go away on their own. Unfortunately, in heart-related cases, time is critical. The earlier the treatment begins, the better the outcome. In conclusion, a heart attack is not always as sudden as it appears. The body often gives warning signs, but they can be subtle and easy to ignore. The 5 hidden symptoms we discussed, unusual fatigue, chest discomfort, shortness of breath, pain in other parts of the body, and sudden sweating, are important signals that should never be overlooked. Understanding these signs, along with maintaining a healthy lifestyle, can significantly reduce risk and improve heart health. Awareness is one of the most powerful tools we have in preventing serious health problems. Thank you for watching, and remember to always listen to your body and take care of your health with awareness and responsibility.